Assalamualaikum to the Dr. Saliha and fellow friends. Today we, Group 1, would like to present about nutrition therapy case study assignment. So we got a case study 1 which tell about Siva. Siva is a 47 years old Indian male and have a weight about 76 kilogram and have a height about 168 centimeter. Siva newly diagnosed with a type 2 diabetes mellitus and have a blood pressure about 125 per 83. Siva always smoking about 20 cigarettes per day and have a symptom such as a polyuria and polydipsia. So this is a diet history of a Siva. The mostly meal is prepared by his wife. For the breakfast, Siva take a Milo and sugar, also biscuit. For a morning snack, Siva take a tosai, curry, Milo and sugar. And for the lunch, Siva take a white rice, fish and chicken cooked with a fried or curry and then vegetables stir fried and plain water. And for the dinner, Siva take a fried rice or mee goreng, fried egg and teh ice. So let's move to the MNT for the type 2 diabetes mellitus. So the first one is diet. Diet contain carbohydrate, fat, protein, fiber, total sugar and sodium intake. For the carbohydrate, must consume about 45 to 60% per day. Carbohydrate must focus on the complex carbs such as whole grain, vegetable, and legume. For the fat, we must consume about 25 to 35% per day. So the healthy fat source such as avocado, nuts, olive oil. So the type 2 diabetes mellitus patient must limit their intake of the saturated fat and avoid trans fat to reduce cardiovascular risk. Next, we move to the protein. The protein intake for the 1 day is 50 to 20% per day. So the patient must consume lean protein such as a poultry, fish, bean, and tofu. This help to stabilize blood sugar level. Next is fiber. Fiber must be consumed about 20 to 30 gram per day. So the high fiber contain such as a grain, fruit with skin, legumes, and seed can help to slow down glucose absorption and improve glycemic control. Next, sugar. The total sugar that need to consume is about 10% only per day. So the patient must avoid sugary beverage or snack, but the patient can consume naturally sweeteners such as stevia. Lastly is sodium. Sodium intake per day is about less than 230,000 per day. The sodium can be reduced uh, in the cooking method uh, using the more herbs or using a natural umami flavor such as a mushroom to enhance the taste. So we'll move to the behavior. The patient must control their alcohol intake because alcohol can cause the hypoglycemia and weight gain. So for the man, we limit the alcohol can intake is only 2 drink, and for the woman we limit only 1 drink. For the tobacco, the patient must be avoid completely. So the tobacco can increase the risk of cardiovascular disease, also can make the insulin resistant. Next, we move to the physical activity. The physical activity can improve insulin sensitivity, can weight loss, maintain cardiovascular health, and build the muscle. So the physical activity recommend about uh 150 minutes per week. So the example of physical activity that patient can do is jogging, badminton, brisk walk, or uh, do something active instead of lying in the bed.
Next, move on to part 2, Indications of carbohydrates counting. The table 2.1 shows the total carbohydrates consumed by stevia. So based on the carbohydrates counting, stevia's total carbohydrate intake is 350.7 grams, which exceeding the recommended range of 45 to 50% of total calorie intake for type 2 diabetes. That the dietary guidelines suggest adults with diabetes should intake 40 to 60% of carbohydrates, 15 to 20% of proteins, and 20 to 35% of fats. Therefore, Shiva needs to reduce his carbohydrate intake, such as white rice, Milo, sugars, and biscuit. The Clinical Practice Guidelines (CPG) recommends individuals with obesity and type 2 diabetes mellitus should reduce their calories intakes by 500 to 1,000 cal per day to achieve an initial weight loss of 0.5 to 1 kg per week. Carbohydrates counting is a useful tool for managing blood glucose level. It involves tracking the amount of carbohydrates intake consumed in each meal and adjusting insulin doses accordingly. Type 2 diabetes mellitus patients should focus on complex carbohydrates with low glycemic index (GI), which digest glucose slowly and maintain a stable blood glucose level. Shiva should adopt a low-calorie diet paired with physical activities, for example by switching sugary drinks to carbohydrate-free beverage such as unsweetened tea and plant water. Men are advised to consume around 60 grams of carbohydrates per meal, while women should aim for about 50 grams. Shiva can control his carbohydrates by replacing white rice with alternatives like quinoa, cauliflower rice, or whole grains. For a healthier diet, Shiva can include lean protein sources such as chicken or fish, boiled vegetables, and healthy fats like avocados and nuts. Besides, one carbohydrate exchange is equivalent to 50 grams of carbohydrates, which is about 65 calories. For example, one slice of bread contains 50 grams of carbohydrates. Shiva could replace toast with curry and Milo with unsweetened yogurt and chopped fruits. Carbohydrate counting can also be managed by reading nutrition labels, focusing on serving size and total carbohydrates, such as sugar, starch, and fiber.
Now, I would like to present 3.1 nutrition assessment. First, anthropometry. Height is 168 centimeter with weight 76 kilogram. BMI is 26.93 kilogram per meter square. Therefore, Mr. Siva is overweight. In terms of biochemical, plasma glucose is 9.1 millimole per liter, which is significantly higher than normal range. Indicates that he may have hyperglycemia. Glycated hemoglobin indicates that Siva has diabetes with its extremely elevated HbA1c level. In terms of blood pressure, Siva's blood pressure is 125 per 83 millimeter per mercury, which is slightly elevated but not yet at the level to be classified as stage 1 hypertension. Next is clinical assessment. First, newly diagnosed with type 2 diabetes mellitus has symptoms of polyuria and polydipsia. Medication is metformin 500 milligram BD. Dietary. Sivas has high intake of fried and fatty foods, may lead to weight gain and increase the risk of heart-related issues. Siva's diet appears to be high in refined carbohydrates and added sugars, as he takes sweet drinks 3 times per day and takes milk 3 times a day, with 1 time a day for snacking. Siva's diet is lacking in fruits and vegetables. In terms of others assessment, Siva has smoked 20 cigarettes per day. Next is nutrition diagnosis. In terms of intake, excessive carbohydrate and sugar intake is related to food and nutrition related knowledge deficit and lack of selection to healthful food choice, as evidenced by Siva's hemoglobin A1C is more than 6% and fasting blood glucose sugar level is more than 126 milligram per dl. Excessive fat intake is related to a food and nutrition-related knowledge deficit, as evidenced by Siva's large portions of high-fat foods. Next is excessive energy intake. is related to lack of access to healthy food choices, as evidenced by the estimated intake of energy being in excess of estimated energy needs and BMI greater than 25. In terms of clinical impact, carbohydrate metabolism is related to type 2 diabetes mellitus, as evidenced by the patient's medication metformin with 500 milligram doses 2 times daily, as well as polyuria and polydipsia. Overweight is related to a food and nutrition-related knowledge deficit, as evidenced by severe BMI, which is more than the normative standard for age and gender. In terms of behavioral, food and nutrition-related knowledge deficit is related to the harmful attitudes about food, nutrition, and nutrition-related topics, as evidenced by SIVA's inability to apply food and nutrition-related information due to frequent and high sugar intake, as well as lack of consuming fruits and vegetables. Self-monitoring deficit is related to food and nutrition-related knowledge deficit, as evidenced by severe food intake data inconsistent with weight status. Next is nutrition intervention. Diagnosis 1 about excessive carbohydrate intake. It will be advised to take bedtime or pre-bed snacks to prevent blood glucose level from dropping too low during the night. Diagnosis 2 excessive sugar intake. Siva will be advised to reduce the intake of sugary drinks in his diet. If he cannot reduce the amount of sugar due to his preference, he can substitute the sugar with non-caloric sweeteners for short-term replacement. Mr. Siva also advises substituting the starchy, high glycemic index and glycemic load foods with low GI and GL foods. Diagnosis 3 excessive fat intake. Siva will be suggested to avoid oily foods such as fried food. This is because oil has a high content of fat. Besides that, food that has the content of coconut milk also needs to be reduced because coconut milk is high in fat. Siva needs to read about nutrition to get knowledge about types of high-fat foods. Diagnosis 4 excessive energy intake. Educate, explain, and advise patients to have a healthy lifestyle by doing physical activity at least 30 minutes twice a week in order to reduce excessive weight gain and energy intake, as well as to achieve weight loss. Follow up patient daily food intake by checking on their daily meal record keeping, eating more nutrient-dense foods such as fruits, vegetables, whole grain, nuts and legumes, and consuming fewer trans fat and saturated fats, refined carbohydrate, red meat, and high sugar food and beverage. Diagnosis 5 overweight. He also should consume a moderate intake of carbohydrate and incorporate high dietary fiber. Siva should also smoke cessations if possible. If not, try to reduce the number of cigarettes per day gradually. Diagnosis 6 food and nutrition related knowledge deficit. The registered dietitian should discuss the purpose of the nutrition education intervention and explain the relationship between nutrition and diabetes issues. It can also provide diabetes education to the patient on how to use carbohydrate counting and consider fat and protein content to determine mealtime insulin dosing is recommended. Diagnosis 7 self-monitoring deficit. The patient will be advised to self-monitor blood glucose to ensure that the blood glucose level remains within the target range. Nutrition monitoring and evaluation. First, can monitor, measure, and record the blood glucose sugar regularly. Perform the HbA1c approximately every 3 to 6 months. Monitor, measure and recorded the blood pressure regularly. Record the food intake for 3 days using a 24-hour dietary record and refer to a registered dietitian. If the FPG and HbA1c are not improving, Siva needs to be reassessed and develop a new meal plan and goals for further interventions.
So before we are going into the meal plan for Siva, we need to calculate the BMI and also the macronutrients need for Siva. So for BMI, the weight will divided by the height with meter square. And she has a 76 kg of weight and also 168 of cm of the height. So the BMI is calculated and we get 26.93 kg per meter square of BMI. So it is category in overweight. So for the energy value, we calculate, we use the weight and multiply by the 25 and we get 1900 kilocal. And so we also calculate the protein intake, protein needed for the Siva. And the micronutrients calculation is also calculated, and there is the macronutrients has included carbohydrate, protein and fat respectively. So for this table has actually shown that the food distribution for calculating the Siva needs. So for carbohydrate, protein and fat, it is calculated. The first row has actually shown that the macronutrient needed that shown in the previous slide, and the exchange has already calculated and we get the total of the food distribution. So for the meal plan, the milk and milk products will have for the Siva will recommended for breakfast and also for the supper, and also fruits will be consuming in the morning snack and dinner and so on. So for this slide is actually telling about the meal plan of Siva, and there are breakfast, morning tea, lunch, afternoon snack and dinner and also supper. It is good to distribute in this in a small portion and frequent meal as it is more suitable for the Siva. And for breakfast, they are recommended for salad and also 2 slices of wholemeal bread and cheese and also plain yogurt. And this is actually following the food distribution previously in this slide. And and this actually has shown the breakfast until the supper, the recommended meal plan for the Siva.
Healthy eating is a very well-balanced diet that supports optimal performance, healthy weight, and reduced chronic disease risk. It is essential to consume different food groups daily for balanced nutrition. To the times, the meal portion has the meal portion sizes have increased, so it contributes to weight management chance for the consumers. Hence, balanced diet involves eating fewer unhealthy foods and more nutritious options. The goals of MNT for type 2 diabetes mellitus is to maintain target blood pressure, cholesterol, and glucose levels. It also prevent or manage microvascular and macrovascular complication. The, main, the macronutrient distribution for MNT type 2 diabetes mellitus is protein, which is 15% until 20% of total energy, while carbs is 45% until 60%, and fats need to reduce to 20% until 35%. The dietary recommendations of MNT for type 2 diabetes mellitus is to focus on low glycemic index, minimally processed, and high fiber carbs. Also, non-starchy vegetables, fruits or whole grains, and dairy products with no added sugar are ideal. Lastly, the usage of non-nutritive sweeteners, and low-calorie beverages continuously as an alternative to sugary drinks. Next is the carbohydrate intakes. It helps to reduce carbs, improves blood glucose, and short-term weight loss, but has limited long-term weight impact. Hence, low-carb diets perform a better for HbA1c reduction than high-carb diets. Next is the protein guidelines is the chronic diabetes nephropathy 0.8 gram per kilogram of body weight. The general population is 1.0 to 1.2 gram per kilogram body weight. It is determined that the moderate high protein diets of total, which is 20% until 45% of total calories, help with weight and fat loss. The fat intake for type 2 diabetes mellitus is saturated fatty acid, which is less than 7% until 9% of daily energy. Replace saturated fatty acids with monounsaturated fatty acids and polyunsaturated fatty acids. It's emphasized plant-based sources. Okay, next is the dietary approach. Okay, firstly is the DASH diet that supports high blood pressure management and cardiovascular health. Next is the Mediterranean diet that improves triglycerides and glycemic control. Also emphasize moderate to low carb intake while meeting micronutrients requirements.
There I will share some practical cooking tips for managing type 2 diabetes by making small changes in how we prepare meals and how we support healthier lifestyle. Okay, the first one is reduce fat and oil. Reduce fat and oil will minimize unhealthy fat and oil. We can do this by using non-stick pan, or we can use air fryer, and we also can use olive oil or canola instead of frying. We can try grilling, baking, or steaming for healthier alternative. The next one is prepare lean protein. Okay, lean protein. We have other options like grill or steamed fish, such as mackerel, lean meat, or Azlan. Or by adding yogurt base, marinade also can enhance the flavor while keeping the meal healthy. The third, by adding fiber to our meal. Incorporate vegetables like spinach, broccoli, along with whole grains such as brown rice. Legumes like lentils, chickpeas are also a great source of fiber that help maintain stable blood sugar level. The fourth is staying hydrated is important. So, choose plain water or unsweet herbal tea. For snack, choose roast chickpea or veggie stick with yogurt dip made for delicious and healthy option. In conclusion, by incorporating this tip into daily cooking routine can make a significant difference in managing type 2 diabetes. That's all from me. Thank you.